Tuberculosis, the lung disease, has been declining around the world. But across Africa, cases are increasing, especially in Sub-Saharan countries. But now there's hope with new vaccines in the pipeline. At the World Economic Forum in Davos, the head of the World Health Organization said that one of the most important lessons from the COVID-19 response is that solutions can be delivered fast if they are prioritized internationally.
So, we have now 16 candidates under development. Many of these vaccines, by the way, were the candidates before even COVID. And the difference between COVID and the 16 candidates is the whole world focused on really finding a solution for COVID. So it accelerated the development of the COVID vaccines, while TB that started decades ago, some of them are lagging behind. We have the BCG, which is 100 years old, 100 years, that's it. So what's now needed is the renewed commitment, real one, I will borrow from her, really action with a sense of urgency, believing that we can do it. It can be done. If it was done for COVID, there is no reason that it cannot be done for this. And we have a lot of information on the 16 candidates already. And we said for COVID, accelerate, so we can accelerate this one too.
To talk more about this is my next guest, Evelyn Kibuchi. She is the Chief National Coordinator of the Stop TB Partnership Kenya. Hello, Evelyn. Welcome to the program. Now, we just heard the WHO Director General, that's Tedros Ghebreyesus, saying we can fast-track a tuberculosis vaccine. What would that mean for your work?
That would be very exciting news because we are continuing to lose so many people to tuberculosis. Just in 2020 alone, the world lost about 1.6 million lives to tuberculosis, which is preventable. So if we had a vaccine, then we would greatly reduce the number of lives that we are losing to tuberculosis.
Okay, but we already have the BCG vaccine against tuberculosis. How might the new candidates be better?
We all know that the BCG vaccine, first of all, is very old. It is not effective. It only meant to prevent the more severe forms of tuberculosis. And right now we are seeing even people who have been vaccinated with BCG getting infected. We are getting children of 3 months who received the BCG vaccine getting infected with tuberculosis. That means the BCG vaccine is not effective at all. It's not helping us in any way in reducing the number of new infections and deaths related to TB. So any new vaccine would be very welcome.
Okay. Now, mass vaccination, we all know, requires a lot of money. Now, we're talking about introducing new vaccines. Where is the funding going to come from?
If we can learn from the experience of COVID, we had COVID, and within about 2 years, we had new vaccines, and we have been able to give mass vaccination to almost everybody in the world. If that has been possible with a disease that has just ravaged the world for 2 years, then I believe the same funders or the same grants that have been used for COVID vaccine, I'm sure those institutions will be generous enough with the understanding that they're saving lives to invest a similar effort and similar investments to ensure that we get a TB vaccine that is effective, affordable, equitable, and that is going to stop the senseless in new infections.
Just so that people can really understand the situation on the ground, tell us about the scale of the TB problem in Kenya, your country, for instance.
Kenya is one of the countries that are high in the list of the high TB burden countries. This is a list of countries that contribute to 80% of the total global burden. Kenya is among those countries. We have been losing about 21,000. In 2021, we lost 21,000 lives to tuberculosis. That compared to the number we lost to COVID, which was about 7,000, we can see it's more than threefold the lives lost to tuberculosis in 1 year. And we have still new infections. we have drug-resistant TB infections, and we're still having children getting infected and dying from TB. So it's still a huge public health menace.
Yeah, sounds like a dire situation. So what are you saying? What hope is there for someone who catches tuberculosis now?
There is hope, I would say, in that we still have a treatment that is effective and is affordable. Well, in fact, it's offered free in the government hospitals. So there's hope in somebody who gets infected. What I am not very sure of is the hope in somebody who is not yet infected, who we could have prevented had we had a vaccine. I'm not promising that hope until we have an effective vaccine.
Okay, now quickly before I let you go, how can people protect themselves against TB?
We can protect ourselves by first understanding what causes TB, that is, staying with somebody who is infected, who has not gone for treatment, living in congested places, having poor nutrition, and not seeking, staying with somebody who is infected and has not sought treatment. So if we learn those things so that we avoid being in congested places, opening windows and doors wherever we can, whenever we are in congested places, and asking those who are infected to seek early treatment. That way we can we can reduce chances of getting infected, not that we can keep away.
Okay. Evelyn Kibuchi, Chief National Coordinator, Stop TB Partnership. Thanks for sharing your expertise with us.
Thank you.